Hi, my name is Elena Rumble. This presentation is about collaboration and leadership reflection for the class Nursing FlexPath 4010, Leading People, Processes, and Organizations in Interprofessional Practice at Capella University. Interprofessional collaboration in healthcare is essential for patient safety and providing a high quality of care. Poor communication between healthcare professionals will lead to errors that threaten patient safety. There is a need for interprofessional training to improve patient-centered care. Morgan 2020. Collaboration in the healthcare field is identified as the ability of each healthcare professional to capably grasp complementary roles within a team, work together, share the duties for problem solving, and make the needed decisions to develop and carry out plans for patient care. Studies show that interprofessional collaboration between physicians, nurses, and other healthcare team members increases the collective awareness of each other's insight and skills, subsidizing the quality of care through improved decision making. Busari et al., 2017. In this presentation, I'll bring up the issue of poor interprofessional collaboration that leads to inefficient management of the human and financial resources, the best practices of leadership strategies, and the best practice collaboration strategies to help a team achieve goals. I will back it all up with peer-reviewed literature that is not older than 5 years. Reflecting at Villa Health case, I observed that there is a lack of communication between management, team, and IT regarding the implementation of the new computer system, creating stress and putting patient safety in danger. I work on a busy telemetry floor. Every day we get to interact with different professionals involved in the care of our patients, starting with the physicians, respiratory technicians, physical therapists, occupational therapists, speech therapists, and nursing assistants, dietitians, and housekeeping. For the best care of the patient, it is important that the team collaborates well. If there is miscommunication, patient safety is in danger, the hospital can incur unexpected costs, and the patient's recovery could be prolonged. That's why the leadership must assure that the care providers have a path of communication that is efficient. In my hospital, as a nurse, we communicate with the physicians during rounds, but also through a program called Perfect Serve Care Team. Through this program, we can get a hold of the physician and we can get their attention. We can send routine questions, but also they have an option for an urgent communication and even a phone call. We are thankful to have this tool, but it's not foolproof. There are physicians that are not adhering to this tool, making patient care difficult. The management needs to address the issue by communicating to those physicians that the lack of collaboration creates a higher risk of error and the quality of patient care is not optimal. Busari et al., 2017. Another problem is poor communication between hospital units. A recent incident comes to my mind. I had a patient transferred from the emergency department, admitted for weakness and falls. They sent her to my floor and did not report that she arrived or that she had a history of seizures. When we get the patients on the telemetry floor, we immediately put them on a cardiac monitor. About an hour passed and I found out the patient was there and she wasn't on the monitor. Nobody knew she arrived. Eventually, a nursing assistant let me know that my patient is not responding to verbal stimuli. I quickly went to her room and tried to wake her up. After giving her a chest rub, she opened her eyes, but she couldn't answer any questions. I called the operator and announced a medical response team. The neurologist, physician assistant, charge nurse, nursing supervisor, and 2 nursing assistants came immediately. After hooking her up on the telemetry monitor, we observed that her heart rate was high. The neurologist thought that she had seizures and put her on Capella. Because of her acuity, the core team decided that she needed to be transferred to ICU, intensive care unit. The lack of communication delayed this patient's care and possibly lengthened her recovery and the cost of care. On the telemetry floor, when we have unsafe incidents, for the staff or the patient, we must report them to a site called Safety First. The leadership role reads those complaints and decides how to solve the safety issue. Later in the week, we had a staff meeting involving all the workers involved in this incident. The emergency department nurse ignored the history of the patient and the gravity of her state. She stated that they were short staffed and she just wanted to move patients from emergency room holding to the floor because the waiting room was packed and they needed to triage the people there. The transporter brought the patient on the telemetry floor without informing anyone of her arrival, stating that she didn't know she was supposed to report. Communication failures during transition of care have the potential of causing harm to patients and directly causing delays in treatment or inappropriate therapies. Catherine Morgan, 2019. According to Bianchi et al., nurse managers have a particular influential role on the implementation of evidence-based practice in terms of providing a supportive culture and environment. For this, they need to have an underlying knowledge, but also be aware and address barriers to implementation and understand the key role of nurse managers in creating and supporting the optimum environment. Nurse managers need to facilitate and enhance nurses' use of evidence-based practice. Both managers and nurses need to have the necessary academic preparation, support, and resources required for practicing using an evidence base. Shifting the blame is not a part of solving a problem. The leadership listened to us and pointed what was done right and what needed improvement in this case. The lack of staff is a significant safety issue contributing to many mistakes. Also, interprofessional communication shows a need for improvement. The management proposed that the transporter must report to the nurse that takes over the patient. The transporter did not agree to that idea because they're often rushed up and it's hard to find a certain nurse on the floor. The nurse proposed that the transporter inform the charge nurse unit or unit clerk at the nursing station. Everyone agreed that this is a better solution. The telemetry nurse also mentioned that the emergency department often sends unstable patients to the telemetry floor instead of intensive care or progressive care unit, which results in codes that were not manageable on our unit. The management proposed a better determination of patients that cannot go to telemetry floors, such as those needing cardiac drips and stroke patients who can be treated in progressive care or intensive care units. In this case, the website Safety First proved to be an essential source of getting to the root of the problem. All employers of our hospital have the chance to report incidents that are deemed unsafe for the patients and the staff. The nursing supervisor brought this incident to the hospital CEO, who decided that all staff must be kept up to date on education regarding reporting incidents to improve working conditions and the level of patient care. In this case, the incident brought an opportunity for improving communication and collaboration between the team members of the care team. Quote, the coordination and delivery of safe, high-quality care demands reliable teamwork and collaboration within, as well across, organizational, disciplinary, technical, and cultural boundaries. Rosen et al., 2018. Thank you for watching my video.